Okay, so Erica's going to share our slides. Okay, so once again, welcome to our Webinar Wednesday series. We are so excited that you're here to learn a little bit more from Dr. Shauna Henley. She is in her 10th year as the Senior Family and Consumer Sciences Agent at the University of Maryland Extension. Her master's was in nutrition and food sciences and a doctorate from Drexel University in food microbiology. So she's going to have a lot to share with us today. But first, I just want to acknowledge our sponsor for this event, Rural Maryland Council. The Rural Maryland Prosperity Fund has been generous to support this program as well as some other programs that we are doing in the community. I wanted to just share a little bit about our mission. I apologize if this is a repeat for those of you who have joined us before, but our organization provides educational resources and support through equitable community-based activities and services in order to recruit, retain, and train healthcare professionals on the Eastern Shore by the way of collaborative and innovative partnerships. And this presentation today is an example of one of the partnerships that we have and that we're able to deliver this program. Our vision is that we envision service and provider expansion covering Maryland's Eastern Shore while promoting healthy communities and a well-trained health workforce in underserved areas. So just some general notes for those of you who have not joined us before. We will start with a presentation and end with a question and answer session. We ask that you remain muted when you're not asking a question. There's not a large number of us on here today, so if you just want to unmute and ask your question, I think that's perfect. We would love to see you if you're able to turn on your video. We do have the chat feature. If you want to ask a question or make a comment, that's available to you as well. And as I mentioned earlier, this is recorded and the videos are posted on our website. So you can go there and see past recordings as well as this one as soon as it's uploaded. We are going to use polling to assess pre and post knowledge. And just so you know, everything is anonymous for the polls. We do not know who responds at all. And at the end, we will have the raffle prize giveaway, and you must be present for that giveaway. Okay, so today we're giving away a digital meat thermometer and some food brushes, which goes along with Dr. Henley's presentation today. All right, so let's get started with the pre-knowledge poll. So on your screen, there's going to be a question pop up, and we just ask that you answer that, and then we'll move on. So here we go. I'm going to launch that. Just one question. Rate your level of food safety knowledge before the session. Is it excellent, good, fair, or poor? Okay. All right, so I am going to end the poll and just share the results. So right now, one person said excellent and 5 said good, but it'll be really interesting to see, what we learn in this presentation from Dr. Henley to see if we do truly have some good knowledge about food safety. So I think we're going to turn it over at this point to Dr. Henley, and she's going to move forward. I'll continue to monitor anyone in the waiting room and admit them as they come in. But again, thank you, Dr. Henley, and we're looking forward to hearing your presentation today.
Great, thank you. And then I'm just going to add in chat a link for demographics for Maryland's forms. And while I'm opening up my screen, feel free, like Lisa said, to unmute yourself. We want to make this interactive and engaging. If you have other questions, please feel free to ask them. My specialty is consumer food safety education, but I've done a lot of work along the food supply chain. So if you're a farmer that's looking to comply with federal regulations under the Food Safety Modernization Act. I've helped with the produce safety rule trainings. I've also assisted with the good agricultural practices. We also have a program around food safety in school gardens for people that are working with school gardens or community gardens. If you're someone that's interested in starting a food business, I work with a team that helps provide guidance in terms of what the cottage food regulations are. Then, if you need to comply with federal regulations under the Food Safety Modernization Act, preventive controls for human foods, I work with our specialists and co-teach that workshop as well. If you're looking for a ServSafe proctor instructor, I'm also that. And then a lot of the consumer food safety education falls around kind of these topics, as well as food preservation. So canning, freezing, and drying. Okay. So today we're going to talk a little bit about food safety. I wanted to start off again, our university is open to all, regardless of affiliation, for our programs and our Justice for All posters. So in terms of my job, for those that aren't as familiar with Extension, I work out in the community in terms of non-formal education. I'm located in Baltimore County and cover Baltimore City, Harford, and Carroll County on topics of nutrition, food safety, and physical activity. So for this one, feel free to unmute yourself or type into chat, but what comes to mind when you hear food poisoning or foodborne illness? So getting sick, throwing up, yep. What else do people think of?
Food contamination.
Food contamination, yep, food that went bad. And sometimes it's not even food that has gone bad, right? It could have gotten contaminated in a different sense. And there are studies that show that our visual cues, taste, smell, touch are really poor indicators of whether or not food is safe to eat or not. And so again, I mean, when you're thinking food poisoning, foodborne illness, there's a lot of things that we can do to hopefully prevent someone from getting sick. So raise your hand, whether it's through the actual video or through Zoom, if you remember everything you ate and drank for breakfast, lunch, dinner, and snack in the past 24 hours. Okay. How many of you remember everything that you've eaten for breakfast, lunch, and dinner in the past week? Maybe not so many. Anyone want to share if they remember everything they've eaten and drank over the course of the month? What about 70 days? So that's the wild thing. Listeria monocytogenes is one of those pathogens where you could eat something contaminated or drink something contaminated and not have any symptoms of diarrhea, vomiting, fever, headache, right? Some of those common symptoms of foodborne illness until day 70. A lot of people want to think that it's what they ate last night that made them sick. But in reality, it could have been something that, sure, it could have been something you ate a few hours ago, a day ago, a week ago, a month, up to 70 days. And it's hard to tell. And so when you're hearing about recalls and outbreaks, it takes a lot of work by people to kind of figure out what was that single food item that made several people sick. So if you're thinking about something like salsa, you might think, okay, well, salsa is going to have tomatoes in it. Maybe your acid's lime juice, vinegar. You might have cilantro. You might have another fruit in there. Maybe you have salt, pepper, cumin, and maybe paprika, chili powder, right? There's a lot of ingredients in salsa alone. And it could be, for example, something like the chili powder that made someone sick. And to figure out that one ingredient out of maybe 12 in your salsa that you ate 10 or 20 days out that made you sick can be really hard to solve. And a lot of times people aren't going to seek medical attention unless they really have persistent vomiting and diarrhea, for example, over several days. In many cases, foodborne illnesses, can kind of come across as like a 24-hour bug. And so a lot of cases actually do go underreported because, again, folks' symptoms resolve. And unless you get really, really sick and need to see your primary care physician or go to the hospital, you're probably not going to be diagnosed. And we also know that those most likely to get a foodborne illness are young children, older adults, pregnant people, and the immunocompromised. So that could be someone with diabetes or cancer or have undergone an organ transplant. So again, it's really important to do what we can to prevent foodborne illness before it actually does happen. So some of the things that we do know about germs is that germs are everywhere, right? There are germs that are good for us, and it's really just a handful that we know to be a public health nuisance. And those are the ones that we're really trying to carry out safe food handling practices for. So again, some of it when you're thinking about food safety and consumers at home, it's more of what their risk tolerance is. Whereas if I was someone preparing meals at a hospital or a nursing home setting, I know that my standards for safe food handling is much higher because we know we're working to serve and feed a more high risk population to foodborne illness. And again, when we compare maybe a hospital setting or a nursing home facility compared to home consumers, there's no one regulating home consumers. And that's one of those interesting things when you look at food safety across the food supply chain, where there's maybe a little bit more checks and balances in place. So the definition of foodborne illness is foodborne illnesses are usually infectious or toxic in nature and caused by bacteria, viruses, parasites, or chemical substances entering the body through contaminated food or water. And that's by the World Health Organization. And we know that cleaning, separating, or preventing cross-contamination, cooking foods, and chilling them appropriately are some of the 4 core behaviors that we can carry out to hopefully reduce and prevent foodborne illness from happening. So again, we're kind of phasing out hopefully more or less of COVID, but some of these symptoms of foodborne illness versus the flu or possibly COVID can be really hard to differentiate. Even now with allergies, right? That's just another layer of symptoms that it might be harder to wade through. So some of the things that you do want to look for foodborne illness, again, is going to be that nausea, vomiting, diarrhea, which can cause to dehydration, muscle cramps. So again, making good judgment and making sure you're seeking the proper medical attention that you need. So one of the things I like to say is if you're someone that lives by yourself, I know talking about diarrhea and vomiting isn't the most pleasant thing to talk about, right? Because it's personal. But if I was living by myself, I might want to have my next door neighbor or a close friend or a relative know that, hey, I'm feeling under the weather. If I don't respond in a day or two, have someone check on me because you might be so dehydrated that you can't think clearly to really call for help like you need it. So again, just taking those precautions for self-care around making sure you do get the proper attention you do need. Other things that we're learning more about foodborne illness is some of the long-term health effects. So the key takeaway is that foodborne illness is more than a tummy ache. And some of the things that we're seeing linked to possible foodborne illnesses are psychological disorders, malnutrition, urinary tract infections, for example. So when you hear someone talking about that crazy cat lady, Toxoplasma gondii is a parasite that is often found in cat feces, especially if your cat is an outside indoor cat. They might pick up this parasite. And you may hear that pregnant people aren't recommended to scoop cat litter if their cat's indoor and outdoor because they know Toxoplasma gondii can be bad for the developing baby. But again, it kind of leads to this idea that maybe there are something more scientific to that crazy cat lady for thinking cats and the parasite of Toxoplasma gondii. Other examples of some long-term health outcomes that we're starting to learn more about are autoimmune disorders, digestive disorders, renal failure, and neurological disorders. And renal failures for hemolytic uremic syndrome, or HUS, is more common with certain sort of SEC pathogens. One of the websites I did want to share is from the Centers for Disease Control and Prevention called FoodNet Fast. It's an interactive dashboard. So I did want to look up some more recent data. So this graph is showing Maryland data from 2012 to 2022, 2022 being the most recent on this website. But you can see that certain pathogens kind of peak during the year. So we see some peaks for, let's see, Salmonella, Vibrio, a little bit with Listeria from June through August. And so some of the things you might be thinking in your head is, oof, those are some pretty hot months in August. And we know that a lot of foodborne pathogens, especially when we're talking about bacteria, love warmer temperatures. So to see them really flourish in these instances makes sense. So it's something, as we're getting into May and getting into those summer months, that we might say, all right, well, maybe I'll pack an extra ice cooler, or maybe I'll think a little bit more of how I'm putting out dishes during our family barbecue, so that plate of deli meat isn't sitting out all day. Maybe I have 2 plates, so I'm letting 1 plate of deli meat sit out from noon to 1 o'clock, and the second platter going out from 1 to 2 p.m. So just thinking about how you're presenting food in a food safe manner for everyone's well-being, because it's more expensive to pay for the healthcare costs related to some foodborne illnesses, especially if you think about needing hospitalization, compared to hopefully doing more of the right thing when it's needed, so everyone stays safe. So with food safety, I really like to say it's a game of I Spy, right? You're looking for things that could cause a potential risk of direct contamination and making sure it doesn't happen. So here's our picture of our cat, Simone. She is on the counter in the kitchen, and underneath the Tupperware is a mouse. We know that 1, cats shouldn't be in the kitchen on countertops. 2, we also don't want mice, because we know both cats and mice can carry pathogens of public health concern. So here, my husband and I were just trying to introduce the cat to what a mouse pest looks like, so hopefully she could help catch them. But again, thinking of where might there be entrances in your home, especially when you're thinking about your kitchen, where pests like mice, cockroaches want to come in. Is there available food? Is there available shelter, water, right? Other things that these pests want, kind of like us. We want a comfortable environment, we want food, we want water, but making sure maybe our screens don't have holes so flies can't get in, making sure our doors properly closed so there aren't gaps for mice or cockroaches to get in and out, can be really helpful. So some of the ways that we might talk about reducing our risks is thinking about hazards versus risks. So a hazard is something that has the potential to harm you, where risk is the likelihood of a hazard causing harm. And this image is helpful, right? We know that it could be hazardous if you saw a shark in the water and just stayed on the beach, because you're thinking, I'm not jumping in the water when I know there's a shark there. It could be bad news. The bigger risk would be hopping into the water and swimming with a shark. So again, you can take this approach with food safety. What could be a potential harm to you or someone in your household, or what could be a risk to you or someone in your household or the place that you work that could cause real harm when you're thinking of food and food safety. So I know this graph is a little outdated, but a lot of the general themes are very similar in terms of the percentages. So when we're talking food safety, we're talking hazards among the biological, physical, and chemical. And we'll get into each hazard a little bit more, but even now, 8 years later, we're seeing majority of our foodborne illness outbreaks occurring by bacterial agents and very few coming from chemical. We also see that viral is an increasing number, and those areas of the pie graph haven't shifted too much, right? So if we're trying to identify what are those hazards, examples of physical hazards are going to be hair, bugs, glass, and wood. Now, those things wouldn't be fun to see in a plate of food, but the chances of them actually giving you a foodborne illness is relatively small. You're thinking that glass and wood, if it was in a salad or another food item, would probably give you a cut or a splinter and really would be unpleasant. Chemical hazards, again, some of the things that I wanted to highlight there, they hopefully won't give you an illness, but you never know. So the bigger examples around chemical hazards might be not labeling your cleaners or sanitizers and someone accidentally putting them into your mixing bowl of maybe cookies. Other things in terms of chemical hazards would be allergens. So if you have someone that's allergic to peanuts and milk and eggs, for example, those allergens are considered a chemical hazard. Examples of biological are bacteria, viruses, parasites, yeast, and mold. And so when we compare physical, biological, and chemical hazards, in general, it's the biological hazards that we can't see with the naked eye. So we can only anticipate what are those situations that biological hazards have a chance to grow and become a public health nuisance. Hopefully, if you saw a hair or any other physical hazards, you can easily remove them. Sometimes with cleaners, right? Maybe they're a different color, so you can clearly see, oh, this cleaner spilled and is touching some produce I'm trying to chop. I'm gonna decide to get rid of all the produce that the chemical cleaner touched and start fresh, kind of thing. Where biological, it's more situational. Other things I wanted to share and resources you might be interested in. There's a lot going on in terms of heavy metals. You might have seen it scrolling through your own personal feeds or whatever the news algorithm is for you. But we do know the FDA, Food and Drug Administration, as well as other federal partners and industry are working towards an action plan to help reduce heavy metals in infant and young children foods, especially if you're thinking back a couple of years to the infant formula issue. Other things too, again, we've added a 9th allergen to what needs to be declared for ingredients containing allergens with sesame. So prior to 2023, there were 8 major foods that needed to be declared on food packaging if they contain those food items or maybe were processed in a facility with one of them. Because again, when you're thinking about allergies and cross contact, right, the unintentional transfer of an allergen somewhere else is that if I'm allergic to peanuts, the only way I know that the candy bar or the salad I'm buying doesn't contain peanuts is by looking for at the label and seeing if the manufacturer or the restaurant has something that says contains peanuts. So right now we have milk, tree nuts, eggs, peanuts, fish, wheat, shellfish, soybeans, and sesame as the 9 major allergens in the United States. And sesame was active as of January 1, 2023. Interestingly, if you were in Canada or going on vacation to the EU, Canada and the EU have 12 and 14 allergens that you would have to declare. So if you're traveling this summer, maybe see what those other allergens are that those countries and union have manufacturers and restaurants declaring that we don't in the United States. So right now we know that these 8 to 9 allergens are causing the majority of symptoms for folks. So whether it's hives, hard of breathing, we know that these, for at least in the United States, are the big ones. There are obviously other food items that can cause allergens and insensitivities, but for the majority of the public, these are the 9 foods in the United States that cause the majority of allergic reactions. Looking at our biological hazards and some of the names that you might have heard of before. So for bacteria, Salmonella, E. coli, Shigella, Listeria, Clostridium botulinum or botulism, viruses, hepatitis A, norovirus, for example, parasites, Cyclospora, Giardia, and then yeast and mold, you have your Aspergillus. When we do think about our bacteria, we do know that there's going to be food, a certain acidity environment, temperature, amount of time, oxygen level, whether it's void or present, as well as moisture that bacteria need to grow. So it's one of those things that if you can manipulate your food environment to not allow bacteria one or more of these items, they shouldn't grow and become a problem, because we don't know if it's one bacteria that can make someone sick or millions. So when you're thinking about food, it could be something like a protein, right? We need protein, we need carbohydrates, and some bacteria need some or both of those to quote unquote eat. When you think about acid, especially with canning, we know that botulism does not grow in acidic environments under a certain pH. So if I was making strawberry jam, I can make it confidently knowing that botulism should not occur. However, if I was making canned green beans and water, which has very low acid and a high pH, we would think to ourselves, okay, I'm going to use a pressure canner to process my green beans and water, so I know I could potentially kill botulism spores from growing and creating its toxin. Temperature, again, most bacteria are going to love to grow in that warm body environment. So think of our body temperature. And again, that graph where we saw the temperatures and more outbreaks occurring in Maryland between June through end of August because of the warmer temperature. Time. Bacteria, when they have all these conditions that are perfectly suited for them, can grow really rapidly. So you don't want to have certain foods out for too long, because if we leave them out really long, bacteria can grow fast. Oxygen. Some bacteria can grow in an environment like us, breathing oxygen, full oxygen, they're good to go. Other bacteria can grow with very little oxygen present. So again, going back to those canned green beans and water, if they aren't processed correctly, botulism can grow because they don't need a lot of oxygen to grow. Moisture, we need water. Bacteria need moisture as well. So again, taking the example back to canning, if I'm making strawberry jam, I'm boiling my strawberries, my pectin, my lemon juice, and my sugar. So all that moisture in the strawberry is cooking off. And as that moisture cooks off out of my strawberries, that's less moisture that any potential bacteria could use to grow. And I always like to say that every bacteria is going to have its own happy place. So again, actually to go back, one of the bacteria that's kind of that outlier for a warm environment is Listeria. We know Listeria can grow at refrigerated temperatures. So again, you might be thinking, okay, Listeria can grow at refrigerated temperatures. So some of the things that I can do to prevent Listeria from growing, even though my temperature in my fridge is safe at 40 degrees Fahrenheit or lower, is making sure I use leftovers in a timely manner, because as those leftovers change their chemical composition as they kind of age, that could be a perfect growth medium for Listeria. So again, using leftovers in 3 to 5 days is really important to hopefully help bacterial growth from various pathogens, and for example, maybe Listeria. So we talked about how bacteria can grow real fast, right? Imagine walking into work today and punching in for an 8-hour workday with $1 in your pocket. By 5 hours into your day, you have roughly $16,000. And think of it this way: when you clock out after an 8-hour day, that $1 that you had when you started work has grown to almost $17 million. And so again, give bacteria the right environment, they can take off like that through exponential growth. So again, being able to manipulate the environment that they would want to grow in and saying, no, we're denying you food. No, we're denying you moisture. You can keep those numbers low. And that's important because, again, we don't know if it's one bacteria that's going to make someone sick or a million. So as we're changing gears and thinking about organic versus non-organic, bacteria don't discriminate. They don't care if your strawberries are organic or not. If it's a good environment for them to grow, they will grow. And so here I just want to highlight that there is data out there to show that organic produce and foods have been linked in outbreaks as well. So it really comes down to safe food handling. And in some cases too, especially when we're talking to maybe folks in the restaurant industry, making sure you understand your buyer and supplier and making sure your suppliers are handling food appropriately. So that could be making sure their walk-in coolers or delivery trucks have refrigeration and if they're kept at the right temperature, sort of thing. The big factor is really the human factor, right? People are great, but people can also be gross. And some of the things that we need to be aware of is our hands and underneath our fingernails and our jewelry are a great way to get germs to cross-contaminate from one area unintentionally to another. Clothing and footwear. You want someone, if they're preparing your clothes, not preparing your clothes, if you have someone walking in preparing your food, you're really hoping that that person has good hygiene, their clothes are clean, right? You don't want someone that has a lot of mud or dirt on their clothes, because you don't know what's in that mud and flaking off into the food that they're preparing for you. Other things too, just being aware of when you are preparing food, your face and your hair. Again, hair probably won't make you sick, but people don't want to see it in your food. We do know that touching your face is often going to be the go wash your hands again, kind of go to jail, not literally go to jail, but using that as a metaphor. If you touch your face preparing food, go wash your hands. When I'm teaching my after school cooking club, we're always reminding the students to go wash their hands because they adjust their glasses, they touch their nose, they touch someone else in the classroom's head, and just go wash your hands, please. Even jewelry is something you may want to consider, as well as watches. So if you're someone that is preparing food and has a bunch of bracelets or a long necklace, how are those items of jewelry interacting or not with what you're preparing? So if you have a long necklace with a pendant and that's going in and out of the food that you're chopping, that's a great source of cross-contamination to possibly occur. Same thing with bracelets. Maybe you're chopping and it's hitting the cutting board and picking up juices from raw meat that might be on the table. Devices. Everyone's probably using a device to find recipes and other activities while you're cooking. And again, there's a lot of studies out there showing that phones and tablets are a great resource to house bacteria. So again, thinking about how often you might need to clean and or sanitize your cell phone. Are there other parts of your hand that you might be able to use to scroll that aren't necessarily your fingertips, depending on what foods you're preparing and how you're directly touching it? Or even thinking, all right, I'm going to follow this new recipe on my cell phone. Let me make sure my screen doesn't time out until after I'm done cooking. So maybe you can change the screen setting. So again, a lot of it is going to be that human factor and what your risk tolerance might be, whether you're cooking food for yourself, for everyone in your household, or another group professionally. A lot of times food's going to be become unsafe because it isn't held at the right temperature or held too long. We know that human hygiene or personal hygiene is another factor of how food can be unsafe. Cross-contamination is another method, and even poor storage practices. So maybe you have all your milk in the door of the refrigerator instead of the body of the fridge where it's colder. So things like that. When we're talking about higher risk food categories, we know that any food can become unsafe. And when we're thinking about that, we can divide it into two buckets. We have our TCS foods, which stands for temperature control for safety, as well as your RTE foods, your ready to eat foods. So those are going to be your foods that you can eat immediately without washing or cooking. So yogurt, that would be a ready to eat food. A sliced apple would be a TCS food. So again, kind of thinking through these examples a bit more. You have an apple, you chop it up. Once your knife goes through the apple, you're kind of starting a clock on it for how long it could be out before it needs to go back into the refrigerator. So again, thinking of what foods you're buying or bringing out with you and how you can best store them, either with or without refrigeration, can be helpful. So some of the things that we think about for TCS foods are going to be your proteins. So it could be your poultry, eggs, seafood, dairy, your cooked vegetables, your sliced produce or your cut produce. And another thing too is produce stored in oil. So again, I know a lot of people like to infuse flavor into maybe their olive oil. So some people will make garlic and oil or herb infused oils, and you would actually want to keep anything that's in oil in the refrigerator to prevent botulism. We also have seen spikes around foodborne illnesses and outbreaks around the holidays. So if you're thinking November, like some major holidays, Thanksgiving, and all the holidays in December, or even the work gatherings and other kind of neighborly gatherings where you might have potlucks or things of that nature, thinking ahead of time of how you might be able to portion out food in a timely manner from a food safe perspective for buffets. So here we see that they're keeping hot foods hot in their crock pots and keeping cold foods cold by having platters, sandwiches, and drinks on ice. One of the key things too with crock pots is you don't want to use them to warm or reheat foods, but use them to actively cook foods. For thawing, right, again, Thanksgiving is another big holiday. Having people think through if they do buy a frozen turkey, how big is it and how long it will take to thaw out in your refrigerator. And do you have that space to let it thaw out in the fridge, or can you cook it frozen, knowing it's going to take longer from a frozen state. And if you are someone that is thawing your frozen turkey in the refrigerator, what does that mean for all the other ingredients that you might have in your refrigerator that now have to be reorganized to accommodate a thawing turkey? This is just kind of an always popular question, more so in November, but even thinking about how to safely thaw anything that's frozen. There's really 3 ways to thaw. You can thaw anything that's frozen in the refrigerator, and actually that's the best method, I would say. It does take a little bit more pre-planning. And then you could also thaw foods in the microwave, but once you thaw something in the microwave, you need to immediately cook it afterwards. Similarly, if you use cold water, you would also want to cook that food immediately. If you let food thaw in the refrigerator, then you don't need to necessarily cook it immediately after it thaws. For cleaning, again, there's so many examples for when and what you could clean. We know that washing hands with soap and water is still the gold standard. So again, it doesn't necessarily matter what your water temperature is, as long as it's comfortable for your hands. Again, I would say if you have liquid soap, don't water the liquid soap down to make it last longer, because there are studies that show that people who have watered down their liquid soap run the risk of having that container contaminated. Also, you're changing that chemical formula of the soap, so it won't be as effective. Another key thing too is drying your hands with a one-time use paper towel. If your hands are a little bit wet, they could still easily cross-contaminate surfaces. There was one study, I forget who the author was, but they found that people who lived with others in their household were more likely to take a cloth tea towel and put it in the washing machine more frequently than someone who lived by themselves. So, even if you live by yourself, you still can be dirty. So make sure you do get that tea towel that you are using into the laundry basket more often than you imagine. Another thing too is the recommendation of not washing poultry or other meats, because the concern is that if you have bacteria on the surface of the poultry or meat, the force of the water hitting the surface could cause bacterial spray. And since you can't see bacteria, you don't know how far that bacteria went, and it's just safer to cook your meat. Also, if you're thinking about quality, if you're cooking a steak, or maybe you have a chicken breast and you want a good sear on it, you want that protein to be dry on the surface and not wet. And if you are someone that washes poultry and other meats because of, well, I guess maybe mainly more poultry because of slime, you may want to think of using a one-time use paper towel to get rid of slime, fat, gristle, because at least you'll be taking that paper towel and throwing it away and washing your hands after. When you're looking at cooking food safely, it falls into a few categories. Typically, you're looking at 145 degrees Fahrenheit for fish and your intact meats like your beef steaks, your pork roasts, your ham, your rack of lambs. 160 is typically going to be your sausages as well as your ground beef burgers. Leftovers and poultry are going to be cooked to 165 degrees. And those are your safe minimal temperatures for foods. Sometimes you'll see, especially with turkey, that people will say, oh, dark meat, you'll want to cook until 180 degrees Fahrenheit, and that's to help develop more flavor. You may also want to use a digital food thermometer because it's easier to read. You're finding more that are dishwasher safe if needed, as well as something that you can recalibrate. The dial thermometers, they have very small numbers. They're a little hard to read sometimes, but a lot of the dial ones, just double check if you're able to recalibrate it as well, and do so every so often. So again, whether it's poultry, leftovers, a quiche, you do want to test what the temperature is in a couple of different areas. Obviously, you want to test the temperature in the thickest part of the protein because that would cook the slowest. You want to make sure that you keep the point away from fat or gristle or bone because that will give you a different temperature reading, which might not be as true for the rest of the meat. There was also an interesting study where people were invited to come cook chicken and just let the researchers know when their chicken was done and they would temp it. And the only thing that the researchers did differently was change out the light bulb. So maybe they had a 50 watt, maybe they had an LED, and they found that people who used visual cues like juices, meat color, um, those changed when the light bulbs changed and they couldn't make an accurate reading. So I would say always use a food thermometer when cooking just for consistency. Also, if you're thinking about it, if you're someone that looks for the color of the meat and the juices and you're cutting the meat every so often, you're going to get a very dried out piece of protein. And for the costs of what meat is today, you might as well use a food thermometer so you're getting the maximum value and hopefully eating enjoyment of that protein. So again, there's a lot of good information around cooking food, food safety coming from USDA, FDA, and CDC. So again, we did talk about leftovers and making sure you eat leftovers within 3 to 4 days. After that, people will say that there are texture changes in the food, and we also know it may allow foodborne pathogens a great environment to grow in, and that's something that we don't want. You do want to make sure your refrigerator is at 40 degrees Fahrenheit or lower. At those temps, most bacteria can't grow in those colder temps, besides Listeria being the outlier. We also know your refrigerator is going to be more energy efficient as well. So if you don't have an appliance thermometer that gives you an actual temperature in Fahrenheit or Celsius, I really encourage you to buy one, especially if you have a power outage over the summer. Another thing too is if you do have a smarter refrigerator that gives you the temperature or beeps, if you don't have that refrigerator hooked up to a generator, buy an appliance thermometer. So again, you have another way to check the temperature if you do have a power outage. Some interesting pieces that people aren't aware of is the message around not eating raw cookie dough. So it's not so much the raw egg, because we already know eating undercooked eggs is a foodborne illness risk. It's more around the raw dough or the raw flour. There has been more recent outbreaks related to flour that's been eaten and not cooked or baked. So again, we may see from the milling industry some way to hemp flour so people could eat cookie dough with flour in a safer manner. But for now, we would say do not eat raw dough. So again, clean, separate, cook, and chill are some basic practices around food preservation, or not food preservation, around food safety. So again, if you have a dishwasher, run your dishes, your cutlery through the dishwasher. We know that cleaning with soap and water won't actually kill pathogens of public health concern, but it's that first general step. If you're more concerned about bacteria, you would want to use a sanitizer. Again, knowing the situations of when you would want to wash your hands is also important. We talked about the new role of cell phones and tablets. And one of the things that we did with adults as well as farmers and youth is having them put on a lotion called Glow Germ. It's not real germs, but it will fluoresce. And you can actually see how well or how poorly you wash certain parts of your hands. So anytime you see that fluorescence is a spot that someone probably hasn't washed well. So in the picture on the left, are you better than the average? Anywhere you see red and orange is typically where people miss scrubbing really good when they're washing their hands. And that handprint on the wall is actually from someone that didn't dry their hands. And you can see that a wet hand is going to cross-contaminate much more easily than if that person's hands were dry. So again, if you're thinking about cleaning and sanitizing, the first thing you have to do is clean and then sanitize. So again, when COVID was going on, you heard more about disinfecting. And from the infographic, we see that sanitizing is going to kill some bacteria and viruses, where disinfecting is going to kill even more bacteria and or viruses, either because you have a stronger concentration of the sanitizer or that disinfectant is applied much longer on the surface to do more kill. But again, read the manufacturer's instructions. And oftentimes when you're talking about food, cleaning and sanitizing is all you need to do. Disinfecting, sterilizing is unnecessary, and typically what you see more in the medical field. So clean and sanitize for food. Cooking, we talked about the safe minimal temperatures. And again, if you're looking at the picture of the burgers on the left and the right, the one on the left is a little bit pink. The one on the right is brown, and it's actually the one on the left that has been cooked to the safe minimal temperature. The burger on the right looks done, maybe, because it's all brown through the middle, but it's actually oxidized. So that pink meat has turned a little bit brown. And again, you want to use that food thermometer that's properly calibrated because our senses aren't always the best indicator. We also know that people are more likely to use a food thermometer for certain types of foods instead of always using them. So again, try using a food thermometer a bit more for consistent cooking and better enjoyment of your meals. If you're someone that's buying mechanically tenderized beef, or just make sure that you're also cooking it to 100 and I would say 60 degrees Fahrenheit, just because the concern is those blades that are making the meat more tender could be pushing bacteria on the surface into the middle. And if you're someone that likes a rare steak, you might not be cooking that steak enough to kill that bacteria in that middle layer thoroughly enough. So again, if you're having any potlucks or thinking about barbecues, making sure that you have enough ice or access to heat to keep foods that need to be cold, cold, and foods that need to be hot, hot. For chilling, especially since we're getting into the warmer months, if the temperature is above 90 degrees Fahrenheit or warmer, you really want to get foods into the refrigerator within an hour. So that could be your cut melons, your chopped salad. It could be your raw meat and seafood because you just went grocery shopping. So again, getting foods into the refrigerator that need to sooner is a lot better, especially as we get into the warmer months here. If you are thinking about storage, again, the image on the right is what retail, so restaurants will follow more so, where the left is more maybe the consumer friendly, making foods have tight fitting lids so things can't leak. Again, considering having fresh produce that might be eaten raw and other ready to eat foods at the top of your refrigerator, and things that are raw and need to be cooked lower, just so you don't have as much risk of raw meat juices dripping onto fresh produce or other foods ready to eat. To briefly talk about food labels, it's infant formula that the expiration date should be followed or must be followed. Everything else that you see, best if used by date, sell by date, that's more for the retailers. It's not necessarily a food safety date. So only infant formula. We talked about cross-contamination. We know that the more direct forms of cross-contamination might be cutting raw meat on one cutting board and then using the same meat that was for the raw foods to prep a salad. So thinking of using 2 different cutting boards, one for raw meat, one for raw vegetables, and even using 2 different knives. Or if you had only one cutting board, cutting produce first and then the raw meat second before putting that cutting board into your dishwasher. Another thing is aerosolization through washing poultry or other meats where bacteria can be aerosolized and land in other areas of your kitchen. And for allergens, that would also be an example of a chemical hazard like we talked about earlier in cross contact, the unintentional spread of an allergen from one location to another. Some of the resources you might be interested, there is a Turkey hotline, but you can also use the U.S. Department of Ag Meat and Poultry hotline to answer any other food safety questions you might have. Other things, if you're interested, there are podcasts called Food Safety Talk, Risky or Not. Risky or Not is much shorter, and you can even ask your own questions there. So maybe you've always wondered if salted butter can stay out on the counter or not. Food Safety News is a daily blog, so it gives you the full scope of what's going on with food safety from a global perspective. If you're looking for educational resources, New Mexico State University's Learning Games Lab has a lot of interesting and fun resources that are fun to use at any age. You could also download USDA's Food Keeper for Apple or Android, and it will help give you some more information about how to best store or best cook different foods. Eatertoss.com is someone out of Northern Virginia. And again, you could subscribe to their newsletter or even submit photos about, can I eat something that looks like this or toss it from a food waste perspective. Again, we talked about some of the federal partners. There's also the Partnership for Food Safety Education, which a lot of people know as Fight Back. If you are someone that's looking for images of safe food handling and best practices of how to integrate food safety into recipes, they do have the saferecipeguide.org. Another resource I like to share with folks is their Produce Pro, just kind of key steps around safe food handling and produce as our farmers are cranking up the fresh produce season. And then they also have free webinars. So one of them, for example, that's coming up next Wednesday is going to be on healthy aging and food safety for older adults. They also have previous webinars that you can watch on pets and food safety and a whole host of other topics that you might find of interest. IFIC, the International Food Information Council, you might be interested in their website where they both focus on nutrition and food safety. University of Maryland Extension has similar resources that might be of use. And if you're interested, PBS has a documentary about the Poison Squad. So this is how back in the day, people would eat contaminated food willingly and see what kind of symptoms they would have. So again, when you think about human ethics, this is a big one where you probably wouldn't want to be in a study like that nowadays. If you're looking for a good book, The Poison Squad is closely related to the documentary. One of the things I'll put into chat is a self-study home food safety audit. So again, if you're thinking about how restaurants go through an audit for food safety, what would an audit look like for normal consumers? So I'll stop sharing my screen and put that into the chat. So the idea here behind the home self-audit would just be to keep you honest to see what might be a potential food safety risk. And it also provides a guide for what you're looking for. So for example, sponges. We know sponges could be something that could cause cross-contamination, but how gross does a sponge need to look before you might think of switching it out? And it'll give you that information as well. So let me put that into chat. And then the question about cutting boards, that's really interesting. It's one of those things where if a plastic or a wood cutting board is deeply grooved, you would want to replace it just because those well-worn grooves could be crevices that bacteria could hang out and grow in a little bit later. So again, thanks for your time, and I'm happy to answer any questions that you have about what I talked about, or if you have questions on things that I didn't address.
Thank you, Dr. Henley. I appreciated the question from Cheryl. Any other questions? I do want to launch the post-evaluation poll and then do our prizes. So I don't want to take up too much more of your time. We're a little bit over time, and I know some of you are on your lunch break. So I'll go ahead if you have a question. Yeah, I don't think you need to share this. Sorry, Erica, because I can't do the poll when we're sharing. Okay, so yeah, let me go ahead and do that real quick. Again, trying to be really cognizant of your time. So 2 questions, rate your level of food safety knowledge after the session, and then are you likely to change your food preparation since participating in this session, please? Okay. Yeah. Anyone else? Okay, waiting on, looks like maybe one more person. Okay, well, I'm gonna keep that up and I'm gonna, actually, I don't know if I can share with the poll. So I'm gonna go ahead and end that poll. It does look like we have better knowledge, more excellence, and everyone has said that they are likely to change food prep since participating in this session. So thank you so much for that. And let me go ahead and share my wheel. Okay. All right, can everyone see the wheel? Yes, okay, great. All right, so I'm gonna go ahead and spin. The first one is gonna be the digital meat thermometer that will just mail you directly from Amazon. And then the second one will spin for the food, the produce brushes. So let's go ahead and see who gets the digital thermometer. Cheryl, okay, great, Cheryl, we'll get that out to you. I don't remember if you are a previous winner, so we'll need your address if you could email us if we don't already have it. All right, go ahead, spin for the produce brushes. Looks like Christine. All right, Christine, if we don't have your address. Oh no, what? Bianca? What's happening? Oh, it's Bianca. I'm sorry, Christine. So sorry. It's Bianca.
Oh, okay. Oh, that's good.
All right, Bianca, we will need your address so we can ship that to you. All right, well, thank you all for attending. We will get this recording up on our website for anyone else that maybe you'd like to share it with. We appreciate your participation. I'm also gonna, Dr. Henley, send out the document for the food audit in an email in case they couldn't access it via the chat.
Great, thank you.
Okay. All right. Thanks, guys. Have a great rest of your day. Oh, and I just want to put a plug in for our next session. It's May 22nd. We're taking a couple weeks off. May 22nd, we're going to talk about the cure to chronic disease with Kara. And she's just talking about what chronic disease is and how we can outline actionable steps to take back control of your health. So excited about that on May 22nd. All right. Thanks, guys. Have a great one.
Thank you, guys.